Founded by a group of community-based volunteers in 1947, the Mental Health Association of San Francisco has provided leadership in mental health education, advocacy, research, and service to diverse communities across the Bay Area for over 70 years. Our mission is clear: cultivate peer leadership, build community, and advance social justice in mental health. We believe that peer support is the building block to a new way forward for those struggling with mental health issues, trauma, and addiction. Our growing network of peer workers and peer-run offerings reduce hospitalizations and healthcare costs and improve whole health in the populations that we serve. Within the next 5 years, peer workers will make up more than 20% of the mental health workforce nationally. MHASF is on the front lines of this movement. Our Institute for Compulsive Hoarding and Cluttering maintains the centrality of a peer perspective in seeking to understand cluttering behaviors. These behaviors are often associated with a significant reduction in quality of life, and in extreme cases, can pose serious health and safety risks. However, the origin of hoarding disorder, also known as cluttering behaviors, as well as how to respond to them from a public health perspective, has been overshadowed by cultural taboo.
Oh, this is when I first started collecting my dolls.
When accumulation becomes compulsion.
Oh my gosh! How did this happen?
Excessive acquisition can have devastating consequences.
I can't take it anymore.
Despite the sensationalized images of hoarding and cluttering we see in popular culture, the reality can be much different. Led by our peer response team, MHASF has taken a leadership role in addressing this little-known and heavily stigmatized issue. And our work has become recognized internationally for advancing best practices and ideas which focus on a harm reduction approach to cluttering behaviors.
We can say to people, I know what it's like. I've had similar challenges. I know how hopeless it can feel, but here I am. I can tell you there is hope, and we can make change happen. Thanks to the work of the peer response team, about 82% of the people who are at risk of either failing inspection or getting evicted have passed inspection or are no longer in risk of being evicted. That is huge. This home became my universe. And some people describe it as an Aladdin's cave. And at that point, I would say to people, well, I live in happy confusion. And at some point, that living in happy confusion became I'm living in unhappy confusion. I think it's all about our relationship to the space that we inhabit. Having a clutter-free space allows us to simplify our lives. It allows us also to simplify what's going on in our mind.
What is your superhero mission to go out into the streets of San Francisco and achieve through your work?
My superhero mission is not just for people to keep their homes, but to also enjoy their lives.
I'm a radical fairy and a shaman, so I have lots of antlers and fun things. This is one of my many decluttering skirts. I wear it because being a guy, I don't normally wear skirts. So it makes decluttering fun. This is my bedroom off the hall. I'm working on it and I'm okay with it for now. If you had seen it before, this is actually progress. I mentioned to a friend that I'd had this realization that I was a hoarder, and he said, so am I, and I'm in a support group at the Mental Health Association of San Francisco, and that's how I discovered MHASF. I started going to the support groups, and shortly after that, like a peer responder position came open, and a light bulb went off over my head and thought, that's what I want to do. So my greatest source of pain has led me to this whole new career path in mental health recovery. You know, just the whole journey of recovery since I found MHASF has changed my life, and I get to inspire other people, which is awesome.
Since 1998, MHASF has held annual conferences bringing together peers, government agencies, clinicians, case managers, landlords, researchers, and all affected by this issue. We offer a comprehensive range of supports that foster community for those personally and professionally dealing with cluttering behaviors, including information and referral, weekly drop-in peer-led support groups, community trainings and presentations, therapist and peer-led 16-week CBT treatment group, families and friends support group, San Francisco Task Force on Hoarding, online INR resource guide to San Francisco Human Services.
I was referred to a peer responder, and that peer responder came to my house and she sat with me and heard my story, and our first few visits were basically getting to know me and knowing how I had gotten myself backed into this corner. And with that, she started to come over and we started to work on my clutter.
The primary reason that peers are effective, and perhaps more effective, is that they have had the same experience. And so it creates a stronger connection one-on-one, and it creates a different level of community.
The Help for Hoarding Study, a 3-year collaboration between MHASF and UCSF, funded by the Patient-Centered Outcomes Research Institute, compared the outcomes of 15 therapist-led and 15 peer-led cognitive behavioral therapy-based groups. The study has already produced findings supporting the effectiveness of both therapist and peer-led CBT groups as an evidence-based practice.
Cluttering challenges is estimated in the United States affect 3 to 5% of the population. That's analogous to the number of people in the United States who are affected with Alzheimer's. The people sitting around this table get it. They understand at a deep personal level all of the things that are so difficult to explain.
For more than 70 years, our work has been built on the foundational principle that people who have been there are the ones most likely to lead you from a place of despair down a path of new hope. That you are not alone, and that recovery is possible for all. For more information about MHASF, including local supports and national and international consultation, visit us online at mentalhealthsf.org.